Hello. This video will talk about how to administer medication with a metered dose inhaler. Normally you do everything on this list, but to keep things concise, we'll focus on the steps in blue, and we'll also include information on how to clean your inhaler and how to use a spacer device. Plus, we'll include a summary.
Start by preparing the inhaler. Insert the medication canister into the top of the inhaler and remove the mouthpiece cover from the bottom. Shake the inhaler for at least a few seconds to ensure the contents of the canister are properly mixed. Now, grasp the inhaler between your thumb and index and middle fingers, like this. Raise the inhaler to the patient's mouth, holding it about 1 to 2 inches or about 2 to 4 centimeters away, and aiming towards the back of the throat. Have the patient open their mouth wide and breathe in nice and deep before exhaling completely. Have the patient tilt their head back a little and slowly breathe in over about 2 to 5 seconds as you fully depress the canister. Have them hold their breath for about 10 seconds before allowing them to exhale. That's the preferred way to do it, but you can also place the mouthpiece directly into the patient's mouth. Have the patient exhale fully and place the mouthpiece between the teeth and over the tongue, aiming towards the back of the throat. Make sure they close their lips around the mouthpiece. Have the patient tilt their head back a little and slowly breathe in over about 2 to 5 seconds as you fully depress the canister. Have them hold their breath for 10 seconds before removing the inhaler and allowing them to exhale. Now, if another dose is needed, wait 20 to 30 seconds before repeating these steps. If you need to administer a different medication, wait 2 to 5 minutes before repeating these steps. Once you're finished, wait 2 minutes before having the patient rinse their mouth out with some water. Keep your inhaler clean by running it under warm water once a day. Allow it to dry completely before using it again. Remember, just the inhaler and the inhaler cap need cleaning. Don't clean the medication canister since you risk damaging it. A spacer device ensures that you get as much of the medication as possible into your lungs by allowing the medication to disperse into the air before you breathe it in. When you don't use a spacer, often some of the medication sticks to the tongue or back of the throat and doesn't enter the lungs. If you have a spacer, definitely use it. Here's how. After preparing the inhaler, simply place the spacer onto the mouthpiece of the inhaler. Grasp the spacer with one hand and the inhaler with the other, like this, and place the mouthpiece of the spacer into the patient's mouth. Have the patient breathe normally through the spacer until they feel comfortable. When you're ready, depress the canister and have the patient slowly breathe in over about 5 seconds. Again, have the patient hold their breath for 10 seconds.
Thanks for watching. If you're interested in a deeper dive on this topic, take a look at osmosis.org, where we have flashcards, questions, and other awesome tools to help you learn medicine.